Cystic fibrosis is a progressive degenerative disease that produces a malfunction in the exocrine system, the system that is responsible for the production of saliva, mucus, and sweat. The disease primarily affects the lungs and digestive system with an abnormal level of thick and sticky mucus produced. This mucus affects the digestive functions of the pancreas and traps bacteria in the lungs, resulting in recurrent infections that often require hospitalization. It is the most common lethal recessively inherited disease in Caucasians and at present has no cure. In Australia, 1 in every 2,500 babies is born with cystic fibrosis. 1 in every 25 people carry the cystic fibrosis gene, which equates to around 1 million carriers in Australia. In this presentation, I will discuss the burden that cystic fibrosis has on Australia, the nature of the disease, symptoms, risk and protective factors, and current strategies government and non-government organisations have put in place to address the current disease. Burden of disease in Australia. Cystic fibrosis is an inherited recessive disorder that kills 1 in every 25,000 live births. Cystic fibrosis also holds a global prevalence of approximately 1 in every 100,000. Management of cystic fibrosis is a relentless lifelong struggle for the patient. Treatment of cystic fibrosis includes daily physiotherapy to clear the lungs, multiple daily doses of enzyme replacement to aid in food digestion, antibiotic therapy for lung infections, vitamin supplements, exercise, and aerosol inhalers. While there is no cure for this disease, these treatments can aid in prolonging life, so much so that there are records of people aging into their 60s. Prolonged exposure to this chronic disease, however, has been reported to develop into a secondary disease, which is a form of diabetes mellitus. The conditional treatment, hospitalizations, and medications that are required throughout the life of a cystic fibrosis patient not only severely impacts the quality of life of the patient, but also places a significant financial and social burden on the community. Nature of the disease. Cystic fibrosis causes the secretion of fluids into the lungs, airways, and ducts of the pancreas. This causes inflammations of the organs, damages to the tissue, and ultimately slowly destroys the two organs. Symptoms. As the population with cystic fibrosis attempt to continue and build a normal life with healthy relationships, it is clear that challenges can arise. These challenges or symptoms may include elevated anxiety, increased chance of depression, frequent bacterial infections, possibility of obtaining diabetes, infertility, a certain shortened lifespan, malnutrition, chronic cough, nasal polyps, chronic sinusitis, pancreatitis, vitamin deficiency, abdominal pain, and cramping with constipation. Risk and protective factors. Cystic fibrosis, as a genetic chronic condition, provides a shorter lifespan for its host, with the average being 37 years, shown in a study conducted in 2006. The risk factors presented from this terminal disease are psychological, especially in young children. The struggle and risk for the child can be presented internally and externally, with depression and anxiety developing as the internal behavior and external being hyperactivity, aggression, and possible behavioral issues. All risk factors presented are psychological, as the family, home, and environment has a greater effect on people with this disease, thus showing that lack of social support and parental stress have a major impact on furthering this condition. As protective factors, the multidisciplinary teams provide care for the person infected with the condition and the families. Here the multidisciplinary teams answer any questions about the disease, thus taking away the pressure for the patient and family so that the depression and anxiety doesn't build within the person infected. Studies also suggest that the prevention of disruption in their daily lives will aid the person to achieve low stress and anxiety levels. Current strategies that addressed the burden in Australia. In Australia, the care of cystic fibrosis patients takes place in government-funded tertiary hospitals, with multidisciplinary teams to control nutrition input in an attempt to combat the malnutrition aspect of the chronic condition. The specialist team's role is to calculate the individual nutritional needs of each patient according to age, lung and pancreatic function, presence of infections, and physical activity. The dietary requirements are usually high in fats, energy, water and fat solubles, vitamins, and in addition must undergo pancreatic enzyme replacement therapy. In order to combat all aspects of the chronic condition and prolong life, there are multiple procedures that need to be put in place to attack every aspect of the disease, breaking it down into respiratory system, gastrointestinal system, and reproductive system. The treatments for the respiratory system include inhalation or oral insertion of saline, Dornase alpha, antibiotics, intranasal steroids, anti-inflammatories, and also physical exercise to mechanically clear the airways. The treatments for the gastrointestinal system include pancreatic enzyme replacement supplementation of vitamins and minerals, H2RA, and proton pump inhibitors. Unfortunately, there is no treatment for the reproduction system symptoms. In conclusion, cystic fibrosis is a recessively inherited disease that has a profound and detrimental effect on the respiratory and digestive system of the patient, which ultimately results in a shortened lifespan. The intense medical care that each patient requires throughout their daily lives dramatically decreases the patient's quality of life and places a huge social and financial burden on the community.